Medical coding written test questions practice exam. 25 most common questions. Question 1. What does ICD-10-CM stand for? International Code of Diseases, 10th Revision, Clinical Manual. International Classification of Diseases, 10th Revision, Clinical Modification. Internal Coding of Disorders, 10th Revision. Integrated Clinical Diagnosis, 10th Revision. ICD-10-CM is the official system of assigning codes to diagnoses. Question 2. Which coding system is used for physician services and procedures? ICD-10-PCS, HCPCS Level 2, CPT, DRG. CPT, current procedural terminology, is used for outpatient and physician services. Question 3. In ICD-10-CM, which letter is used as a placeholder? A, X, Z, S. The letter X is used as a placeholder to allow for future expansion or to meet the 7-character requirement. Question 4. What is the correct sequencing for a patient with hypertensive CKD stage 3, I10, N18.30, I12.9, N18.30, N18.30, I10, I15.0, N18.30. ICD-10 guidelines assume a causal relationship between hypertension and CKD, I12.9, followed by the stage. Question 5. Which modifier is used to indicate a bilateral procedure? -50, -51, -59, RT. Modifier -50 indicates a procedure performed on both sides of the body. Question 6. What is upcoding? Using a more specific code. Assigning a code for a higher level of service than performed. Coding only the symptoms. Missing a diagnosis code. Upcoding is a fraudulent practice of billing for more expensive services than provided. Question 7. Which part of the ICD-10-CM book contains the index to external causes? Alphabetic index. Tabular list. Appendix A, separate section after the table of drugs. External causes have their own index following the main alphabetic index. Question 8. HCPCS Level 2 codes start with a number, a letter, 2 letters, a symbol. HCPCS Level 2 codes are alphanumeric, beginning with a letter, example, J3490. Question 9. Which organization maintains the CPT code set? CMS, AAPC, AMA. Who? The American Medical Association, AMA, owns and maintains CPT. Question 10. What is the principal diagnosis? The first symptom reported. The condition established after study to be chiefly responsible for admission. The most expensive condition. The patient's chronic illness. The principal diagnosis is determined after study for inpatient stays. Question 11. When coding Z codes in ICD-10-CM, what are they used for? Procedures, emergency visits, factors influencing health status and contact with health services, symptoms only. Z codes are used for encounters that aren't necessarily for illness, example vaccines, screenings. Question 12. Which modifier indicates a professional component only? TC, -26, -52, LT. Modifier -26 is used when only the professional work, reading the scan, is billed. Question 13. What code set is used for inpatient hospital procedures? CPT, HCPCS Level 2, ICD-10-PCS, ICD-10-CM. ICD-10-PCS is used exclusively for inpatient hospital procedures. Question 14. Evaluation and Management, E/M, codes are found in which book? ICD-10-CM, ICD-10-PCS, CPT, HCPCS. E/M codes, example 99213, are part of the CPT manual. Question 15. What does a bullet symbol next to a CPT code signify? Deleted code, revised code, new code, add-on code. A solid circle/bullet represents a new code for that year. Question 16. Which coding guideline states that you should not code signs and symptoms when a definitive diagnosis is made? Section I.B.4, Section 2.A, Chapter 18, Section 4. Standard coding practice is to only code the definitive diagnosis if it has been established. Question 17. A patient is diagnosed with acute and chronic cholecystitis. How is this coded? Only acute. Only chronic. Code both, with acute first. Code both, with chronic first. When a condition is both acute and chronic, code both, sequencing the acute code first. Question 18. What is the purpose of NCCI edits? To increase revenue. To prevent unbundling of codes. To provide new codes. To audit patients. National Correct Coding Initiative, NCCI, edits prevent improper payment due to unbundling. Question 19. A patient's record states rule out pneumonia. How is this coded for an outpatient visit? Pneumonia. Signs and symptoms, example, cough, fever. Do not code. Z03.89. In outpatient coding, rule out diagnoses are not coded. Code the symptoms instead. Question 20. Which code range represents the digestive system in the CPT manual? 10,021 to 19,499, 40,490 to 49,999, 60,000 to 69,999, 70,010 to 79,999. The 40,000 series in CPT covers the digestive system.